Hey everyone, it's Dr. Namani and Dr. Louie back today with another episode of The Athlete'Spine. And we're really excited to have Dr. Harry Cessi on with us today. He's the Director of Health and Performance at GOLFLETICA, which is in Bellevue, Washington. And he is the consultant for a lot of the tour professionals on the PGA Tour. So we're really excited to have him here today. So welcome.
Thank you, guys. Pleasure to be here.
Yeah, and I think the topic is sort of perfect that we wanted to discuss today. We recently saw Will Zalatoris return now about 10 months out from microdiscectomies and in his fourth tournament this past week, where he actually finished second, which raises the question, right? Because we get asked from our patients all the time, can I really return to golf after a spine surgery? And we tell them, like, emphatically, yes. But we sort of a little bit misinformed when we make that statement, because we sort of just perform the surgery and we follow them up from a surgical perspective. But it's really experts like Dr. Cessi who actually get them back to play. And that's why we wanted to bring him on today to talk about that. So thanks so much for joining us today.
Oh, you're welcome. It's great. Definitely fire away any questions you have at me, and I'll answer them as best I can.
Yeah, so I'd like to start with kind of probably what's the most common thing that people deal with, which is, someone comes into a doctor with a bad episode of lower back pain, and oftentimes that can be related to a lumbar disc herniation. And so there can be a combination of back and leg pain. And we know that the vast majority of these kind of get better on their own, so within, a couple of weeks, that 90-95% of these will just kind of go away. But that doesn't mean that athletes are ready to kind of go back to playing sports, especially a sport as demanding as golf, where there's a lot of twisting and a lot of torque involved in the spine. So how do you begin to get, especially an elite level athlete, back to play after an episode like this?
Correct. Yeah. And I think there's one thing to remember in that you've got your, say, two buckets of golfers. You've got your amateurs, and then you also have your professional golfers. And for the most part in the clinic back at home, I'll see amateurs with back pain. That's the majority of what they're coming in with. Yet on the professional level, most of them are coming in more with extremity issues, wrists, elbows, and knees. And usually that's because they're trying to save a shot. The ball may be in a tree root or it's deep in the rough. They don't know there's something underneath, and they tend to hurt themselves from the impact position. But there are the times where the professionals do start to have low back pain. And whether it's something they are predisposed to because of something congenital, for example, or it's an accumulation of bad biomechanics over time. And this is where you can see a lot of young, healthy, strong players, and you watch them swing and you're like, wow, that's fast. That guy's strong. That guy hits it far. Or even the women. And all of a sudden you hear in the news, hey, so-and-so's not playing. All of a sudden he's had to withdraw. His back hurts. Worst case scenario, now he's going in or she's going in for back surgery. And this is where it is a little bit of a unique skill in that you have a golfer who has perhaps a microdiscectomy or other lumbar issue, and all of a sudden they have surgery, they have a repair. And if you follow your regular rehab guidelines, whether you're someone like myself, a sports chiropractor, or you're doing physical therapy or acupuncture massage therapy, you can rehab the athlete to the point where, yeah, you can go back to playing whatever sport or whatever activity you want to do. But then you have to factor in the elite level of it. If you have a professional tour golfer, rehabbing them over whatever standard protocols you follow is good to a point. And then after that, you have to throw it out the window, because you've got someone who's now swinging at, well over 100 miles an hour. And honestly, your standard rehab that you would do from the textbook will not hold up to that.
Yeah, so tell us a little bit more about that. I mean, we know the amateur world quite well. We're both wannabe amateurs, but you have a very unique position within the professional golfing world. So what exactly is it that you do, and what role do you play in sort of maintaining performance and getting golfers back to play after these types of injuries?
Yeah, so the good thing is what I do in the clinic will be the exact same thing I will do with the tour players. No difference. I'll treat everyone the same. But I guess I'm a little bit of a hybrid. You can think of me as that utility club that's going to get you out of the rough. I've got a background in chiropractic, which I then specialized in sports medicine for chiropractic, and then did some physiotherapy at school, wrote my boards in that. I've got a massage therapy background, and my main strength and conditioning training comes from my background in Taekwondo, in martial arts. So that's a very highly rotational speed, power, explosion, all of that's involved in that sport. And in the end, I kind of just shook everything up, put it together, and said, okay, what's the problem? Patient comes in, is it your back? Let's see what's going on. I know orthopedically, I can run my tests, muscle tests, neurological tests, and say, hey, you know what? You've got such and such happening at this level. Perhaps it's a disc issue. Let's refer them to yourselves. Let's get another opinion, MRI. But end of the day, whether it's myself trying to rehab them or you guys doing a procedure to help them as well, we do have to do the rehab exercises, which is very important to do them correctly. And then for the golfer itself, whether you are an amateur or a tour professional, the biggest thing is actually working on your biomechanics. Because we know if, for example, you had an issue at L4, L5, maybe a laminectomy, you correct that. If you still have aberrant motion above and below, well, you're just going to still have a problem down the road. And this is where the golfers do have to adjust their swings. If we talk in golf terms, for example, if someone happens to be more of your traditional golfer, where they're going to do kind of two moves, they're going to kind of side bend and then rotate into the swing, which is more your traditional one, versus nowadays, more of them are going to be rotary, more of a horizontal type swing and just turn. No more side bending, which we know is going to jam the facets, especially if they're not holding their spine angle and posture throughout the swing. And this is where, yes, maybe you swing one way and all of a sudden you have surgery, and the discussion is going to be, if you don't want to have this surgery again, or if you want to keep swinging again, we do have to make some changes. And most of the time they'll agree. They love golf. Golfers are crazy. They're a different personality. If you can keep them golfing, they will do what you recommend.
Yeah, an ounce of prevention is worth a pound of cure, right? So trying to keep people out of the operating room and trying to keep them from having the problem that they had in the first place.
Definitely. If you're not moving correctly, I tell everybody, whether you're a pro or not, everybody is one swing away from not golfing again.
Yeah. So the question that we always get is, let's say someone's had a microdiscectomy, and there's now, several well-known golfers. Obviously, Tiger Woods, has had several of these procedures, and more recently, as we discussed, Will Zalatoris, had a procedure back last April 2023. What do you tell an athlete in terms of whether that's an elite level golfer or an amateur golfer who's had a procedure like this, kind of what the timeline is like? When can they start putting, chipping? When can they start back their short irons? And even before that, kind of what's needed in terms of rehab to be able to get them back to playing golf safely?
Right. I mean, we have our traditional timelines of, hey, you know what? The suture is going to heal at this amount of time. We're going to wait about 10 days, couple of weeks, and then we can start moving you a little bit through some general range of motion. But what I've found is that once you get all past that, the biggest thing really is, okay, I know what your sport is. I know what you need to do. So how do we tailor all your rehab exercises more towards that movement? So maybe some things we actually have to do in golf position, in golf stance, hip internal, external rotation, and so forth. And I would say rehabbing the actual surgery area itself, while it is important, I'm actually going to spend more time focusing on all the other areas as to what contributed to this problem in the first place. Is it a lack of thoracic rotation? Is it actual pelvic mobility and you can't hold a good neutral posture, neutral spine? And, is it your hip internal and external rotation is limited, and that's why you ended up moving through the lumbars more than you should? So this is where, for example, if it was an amateur who came in and 3 to 6 months, you can probably start golfing again. But I know they're just going to go around the course. They're not going to be too aggressive with it. You can gradually tell them, hey, you know what? I want you to keep it at a minimum, hit maybe 10, 15 balls every couple of days, and let's see how it goes, and hit some wedges. I will be strict with them, but definitely if it's a professional golfer, I'll be really strict, because now it's not playing for fun, because if it hurts, they can stop if you're just playing recreationally. If you're a professional golfer, this is your job. So I can't have you out there hitting balls, and even if it hurts, I can't have you push through it. So with them, I'll be super strict and say, here's your putter. This is all you get to use for the next 2-3 weeks. And then I will slowly add a club into the bag, because at that point, depending which club they're holding, we're eventually changing their spine angle, from a more flexed position to a more upright position. So as we rehab and get them stronger in the various muscles, that will also start to work in conjunction with that. And that way it's a gradual build.
Yeah, you talk about that pelvic motility and sort of the internal and external rotation of the hips. Those are all so important in your golf swing. For the amateurs out there, especially those with back pain, or even like a radiculopathy, what is a bad swing versus a good swing? I'm asking for a friend. No, but like, how do you?
Hey, Phil, that answer is easy. Your swing is the bad swing.
Well, it's not great.
He's asking for you.
There's room for improvement. I'll let my friend know. But like, how do you know what a good swing is for you? Is it pain? Is that the major sort of barrier, or the sort of lighthouse that we're looking for that sort of determines, okay, this is how I should swing, this is how I shouldn't swing?
So I kind of look at it as, there's an infinite number of ways to swing, but there's really only one efficient way for each person to do it. And it's going to be most pain-free, most efficient, especially. And
yeah, my swing's like efficient.
You're gonna follow the path of most least resistance, right?
Okay.
And that's how you're gonna want to swing. So if I watch somebody swing and they may have an instructor who says, oh, you're early extending or you're chicken winging through the swing, well, I don't look at those as faults necessarily. I look at those as characteristics of their swing, because maybe somebody does have to stand up a little when they're coming into impact because they've had all the low back issues, that they have to do that as a protective mechanism. So how do we work around that? How do I work with their swing instructor to say, hey, he's going to do this or she's going to do this no matter what? How can we change the technique a little to help that out there? Because I think with something like this, everyone knows how to swing a bat, hockey stick. Why I find my sport, Taekwondo, really relates to it is because if I didn't teach you how to punch or kick somebody, you'll still know how to do it. Right. And whether it's my fist or my foot hitting an object, the golf club really is just an extension of it. So I do teach, and even at home, my wife teaches all our juniors, but I do teach my tour players how to kick and punch because it comes natural. You have to load, you have to weight transfer, you have to rotate through, and then decelerate right when you make impact. Right. And if
that's really fascinating. Yeah.
If you're not in the right position, you're not going to hit anything very hard, whether it's you physically or you using a golf club. So I say try not to get caught up with what it looks like. If you are happy with the ball flight you're getting and the results you're getting, that's great, especially if it doesn't hurt, and that you can play multiple rounds without, hey, my back hurts, my neck hurts, my knee hurts. Versus it needs to look this way, because no, it's hard to replicate someone's swing. Yeah.
We're going to start to bring this to a close, but I wanted to ask you kind of for one parting thought for all the golfers that are kind of watching this. What is the one stretch or strengthening exercise that most golfers aren't doing that they should be doing to try to keep them away from injury on the golf course?
I would say if we're going to keep it, actually, the biggest thing we want to protect is your back. If you have a sore shoulder, you're still going to swing a club. Yeah, if golfers are tennis elbow, you're still going to swing a club. But if your back hurts, it's kind of a little bit of a different story, because you're like, I do and I don't, and who knows what's going to happen. But I do say a couple of things that someone should do is, number one, you should do a toe touch, and not so much for the fact that I need you to touch your toes. I honestly don't care how flexible you are, because it doesn't really matter when it comes to golf.
Yeah.
Flexibility is just, hey, how much does a muscle extend, etc. It doesn't tell you how much range of motion you're actually having. But the toe touch I do like, just because it's actually going to teach you to hinge at the hips and not flex at the lumbars, which is then going to cause more low back issues. The other exercise would then to be doing squats. Whatever you can to build a butt, strong glutes. That's the king of the swing. That's going to hold your posture. That's going to help initiate internal, external hip rotation. That's what you want to build. People say build your core, but most people don't understand what their core is. They think it's just the front, but you got to remember it's the front, it's the sides, it's the back, it's the top and bottom of the lid, your diaphragm and pelvic floor. And then guess what? Some of that includes your glutes. So hit the big muscle.
Awesome. Wow. Thanks so much
That's
for joining
great.
us today, Dr. Cessi. This is great advice. I'm thinking through my head how I can start like a kicking and punching routine to work on my golf swing right now. And I guess
You guys can do it at work when you're free.
Yeah, that's true.
It's actually really funny that you say that, because my kids both play ice hockey, and my daughter golfs, and so her golf coach often tells her, hey, when you're practicing your hockey shot, your wrist shot, or whatever, that rotation and that movement is good for golf, and her golf coach actually also told her just to practice sidearm throwing, and you think of like the weight transfer and everything like that. Movement is kind of like what you're talking about, the same as whether you're punching or throwing or swinging a golf club, right?
Definitely. There's a lot of, that's a whole separate topic, like of all the little things you can do. For example, you can teach kids how to throw a Frisbee, and guess what? That's their wrist position right there. Teach them to skip rocks. There's their wrist position right there. Things like tennis and baseball and hockey, very same motion. It's just a different height as far as where your target is. And then also, is your weight on the lead foot or back foot? And that's what makes each sport a little bit different there.
I've been training all wrong all along. Now I know. Cool. Well, thanks so much for joining us today. And
you're welcome. A pleasure.
Yeah, we'll have to have you back on again sometime in the future to actually go through some of these tips more, because I think people really enjoy hearing that. So, but yeah, thanks for joining us, Dr. Nemani, Dr. Louie here, Dr. Cessi joining us. Don't forget to like and subscribe and follow us on Instagram at TheAthleteSpine. All right, take care, everyone.
Thanks, Docs.